Hey, doctor. Thanks for taking my call.
Happy to do it, Adam. What's up?
Hey, for many years now, I sometimes wake up in the middle of the night with a sharp pain in the rectum area,
All right.
and no idea what that's from. It only seems to mostly happen at night, but sometimes the pain is so much that I'll almost pass out and see stars.
All right. How old are you?
I'm 36.
All right. And how many years do you think this has been going on?
Oh, about 15. Actually, at the age of 25, I had colonoscopy done, and
Sure.
they found 2 colon polyps. And then I've had 5 years after that, had a clean colonoscopy.
Okay. Yeah, there are a couple things that can happen. Okay. And I have to ask you a question, too. One, do you have any pain when you poop?
No.
Okay. So any problem with diarrhea or blood in the stool?
I did before my first colonoscopy, yes.
All right. Do you have any difficulty, well, let's say, with constipation?
Nope.
All right. Well, there are a couple things that quickly come to mind. Okay, you can have what's called a perirectal abscess or a perianal abscess, and or crypt abscess actually. And what these things are almost like having a pimple down below, and it'll get abscess and then it'll drain. Okay, if this is something that bothers you every night, it's unlikely to be that. Could you have a small fissure? And the answer is absolutely. Okay, middle of the night, your body is working, it's doing what it's supposed to do. So what you may want to do is to try something along the line of a Tux. You know, it's a Tuck. It's like a little medicated pad, and slide it up there, okay, and see if that doesn't settle things down fairly quickly. These are medicated pads. If it's inflammatory, it should settle it down. Now, there are some odd things that can cause this. You can end up with enteritis that can lead to this, colitis, certain types of infections. Okay, the likelihood's fairly small. So common things are common. And what I would do first would be to go ahead and use something called a Tux. Okay, slide it up there. If that settles it down, super. If it doesn't, or if it's inadequate, okay, typically what I'll do is I'll go to the compounding pharmacy and I'll ask them to make up a hydrocortisone, clindamycin, ketoprofen, what's called a rectal rocket. And these things are suppositories, but they get stuck. You slide them up and it sits there in the rectum and dissolves away, bathing the area in, at the very lowest part of the GI tract. And so if it's inflammatory, the cortisol will settle it down. If it's infectious, the clindamycin knocks it down. But either way, it's a pretty slick technique to get this thing done. So not to make light of your problem, but as they say in the business, rectum, damn near killed him. So Adam, good luck with this one. If you need some help with the rectal rockets, I'll be delighted to give you that piece of advice.